Hello, everybody. This is Laura, Healthy Carnivore. I'm going to go over a little bit of my background tonight again, just for people who haven't seen me or know who I am. I am a registered nurse. I have been nursing over 23 years now. Back in 1991 at 313 pounds and working with my doctor on a diet, decided to take my health in my own hands, went out and studied up, not with Wikipedia or any of Google, because there was no such thing in 1991. Went and studied all the medical journals I could find from 1910 all the way back to 1850. Same with veterinarian type stuff as well. Came upon the lower carb, like no whites, no white breads, potatoes, pasta, sugar, rice, all that stuff. Did that for 9 months. Did it for 28 years actually, but the first 9 months I lost 153 pounds. Straightened out my blood work. Everything was great for 26 of those years. And then I got into the keto crazy food that is not really keto at the store, and maltodextrin, some of these sugar alcohols, a lot of those guar gum, things like that, really did a number on my stomach, destroyed my gut, and caused leaky gut syndrome, anxiety, depression. My OCD was much worse than it is. I like to have just a little OCD. I think a nurse needs to have a little, but it was crazy. Like 2 o'clock in the morning, I'd get up and shampoo carpets because they needed shampooed. So I don't do that anymore. In fact, I probably am too far the other direction now. Um, but in 2019, I came across a Joe Rogan podcast that had Dr. Baker on it, and they were talking about carnivore. And so that intrigued me. So I watched the entire thing and was like, I think that's what I need to do. So that's what I did for healing. 3 years into that, I actually went lion diet, where is pretty much where I'm at right now. I do introduce chicken eggs occasionally that are from like my daughter, people we know, not from the store for myself. I have histamine responses to those if I do. So I've done that, and I have started making El Reuteri yogurt that I have 1 cup every single day, except for the last day and a half because fasting. So just doing a water and electrolyte powder fast is all I'm doing for right now. I think at least 3 days, maybe five. We'll just see how it goes. So that is a little bit about myself. Let me come on here just to see who is here. Hey, Karen, how are you? So she's listening because she's just leaving work. That's good. And Simpson, how are you? Sandy, hello. And Maria Kelly's here. Cheryl is here. Hey, you're still here. That's good. um, Angel says, cheers from Oregon. Thanks for the content. You are welcome. So, I'm not sure how many people out there will have a history of these things, but I'm going to go over them. I don't necessarily see them in like the keto carnivore world for the most part, but elderly, I do see this a lot. And being a home health nurse, that's not all I see is elderly. In fact, recently in the last few years, I've seen a lot of very young, but previously, and nursing home and hospital was a lot of elderly. And this is something that I see a lot with them. Part of it, I do think, is due to dehydration. A lot of it, I think, is due to medications as well. Hey, Tara. Um, so, like I said, I do see this with some medications. Okay. So I see this with some of the like Trulicity, Jardian, some of those medications can lead to that because the way it is getting rid of sugar is through the kidneys and bladder. So you are urinating out high amounts of glucose in the urine. When that happens, you can see some of these issues. So that I will go over with you. If you are ever interested, I say go out there and go to DuckDuckGo as a search engine and type in possible side effects with either of those medications that I listed, and it will blow your mind what is side effects. Side effects, not even the adverse reactions. Those are just like, if this happens, you should. This is side effects, known side effects. So, the thing that I'm going to talk about today is knowing whether it is cystitis or a UTI. So, that is a urinary tract infection. Um, so, I'll tell you the things that I see the most in my practice of seeing patients. Um, Everything out there research wise says that most of the time UTIs are caused by E. coli. Okay. And that's coming from the rectum. So that could be improper cleansing, wiping, all those things. It can be that you have a fistula between the two areas. I have seen that where there is a actual fistula, so like a tunneled area that goes from the rectum across through the vaginal opening and into where the urethra comes to. Um, so I've seen that as well, which is crazy painful. And yes, it has to be packed if you can even imagine. I will tell you that in elderly people, what I found in my years of doing this, um, E. coli is not the number one that we find with them. Um, so it is Pseudomonas. That is the one, and it will give you kind of a very bittery smell to it. It's not like a rotten smell. E. coli has more of a sweet, like trash that's set for too long, maybe out on like a front porch in the heat. Pseudomonas is a very bitter smelling, and you can tell. You can walk down a hospital unit, you can go down a nursing home, you can go in a patient's house, you can go places like that, and you are like, you can catch a whiff of that, and it's like that's exactly what that is. So, with urinary tract infections, they're usually very fast when they come on. It's pretty quick. Most of the time, now this is not set in stone, okay? I didn't get any of these symptoms. So, burning, urgency, frequency, and even a fever. Now, when I first went into nursing and was working at a med surg floor, 12-hour shifts, I am a big proponent of not leaving call lights on for the CNAs to get to. If the call light's on, I can go answer a call light same as they can and should be doing so. But in turn of doing that, a lot of times I put off going to the bathroom myself and actually developed low back pain. I thought I had pulled a muscle in my back and went to, we had a nurse practitioner that we could see for free on site. Went to see her, and she was like, I don't think it's a pulled muscle, doesn't look like it. Um, Asked, how long had I been there? And I was like 6 weeks. And she was like, I have a hunch. And so she had me go urinate in a cup, and it looked fine. Like there wasn't, you couldn't see blood, but a lot of times you can't. It wasn't cloudy. It didn't have a lot of odor to it. But when she checked it, the bacteria count was crazy high. And I don't even remember what the bacteria was. It wasn't E. coli, and I don't think it was Pseudomonas, but I don't remember which one it was. Um, but it had actually backtracked up the bladder, up the ureters, and infected both kidneys, which is called pyelonephritis, which is really bad, very painful. So, most of the time, with most people that get UTIs, you have to do um, antibiotics. There are natural options for that. Um, which I will go into in a few minutes. So, and they do work. And I am not a doctor, I'm a nurse, and this is not medical advice, but I'm telling you what I have used on my family, myself, patients, clients. So, um, the problem is with antibiotics, as most of us here probably know, is that it kills a lot of the bacteria, and we have to have some of the bacteria in our guts. That is where 70% of our immune system starts from. We need those little things in there. We don't want the bad guys, but we have to have some of the good guys. So I always tell my patients they're already on antibiotics. I'm like, get some good yogurt that's got live active cultures, get some probiotics, get some sour cream, kefir, any of that kind of stuff. I'm like, those kinds of things to help remediate the damage that you're doing to the gut. So, interstitial cystitis, which I see a lot of in females, a lot of that is due to hormonal changes, whether you've had a child or not. If you go through menopause, a lot of those tissues, especially like the broad ligament, things like that, that hold things up, tend to get lax and drop like that. And so the bladder, instead of sitting up like this, where you'd have the neck of the bladder going like this down, instead you have it tip like this. So there's always some urine sitting in there. And so dark, warm environments, we know what happens, right? So it can cause inflammation. It can also cause infection if you have that. But chronic inflammation of the bladder is cystitis. So, anything that is itis is inflammation. So it can feel like a lot of people feel when they have a bacterial infection, but it turns out that it's not. The scary thing here is a lot of people will go and have their urine tested and they'll not show any bacteria, and then they just send you home and it's cystitis instead of you know bacterial issue. Some people also will have where they are colonized, so they have had so many of these same infections over time that they get colonized and it doesn't show on them near as much, and people miss it. The doctors just miss it. The difference is the symptoms with interstitial cystitis tend to come and go. Like you'll have, a couple hours where it's really like bladder spasms, where you feel like it's just crazy, and then you'll have times where it's like, oh no, everything's fine. I'm urinating fine, no issue at all. Um, Cystitis can be due to food intolerances and histamine issues. It can be due to hormones, and it can be tied to stress. Nobody has any stress, right? No. Um, so I'm going to give you some things that you can do for both. So for UTIs, and this is natural, and like I said, this is what I have seen done and use myself, is D-mannose, which helps flush E. coli. And that's just the letter D slash mannose, Mannose. Cranberry unsweetened. So you can get like those Crazo or the Azos, makes the cranberry. No sugar in them. They're probably not perfect. They probably do have some things in there, but they're a whole heck of a lot better than a antibiotic that's going to wipe everything out. Hydrating, flushing, flush. If people have a catheter in place, the one of the best things to do for them is acetic acid and water, like normal saline, flushes into the bladder itself through the catheter, which is just white vinegar and water. Okay. And not tap water, normal saline. You do not want to use tap water because of the impurities that can be in it. Shouldn't be drinking it either, but definitely don't be putting it in the bladder because that's not a good idea. So, but if you don't have a catheter and you can't flush that, drink lots of extra water, because if nothing else, a lot of those impurities are larger, in size than what cells and things that are breaking down should be. And so that will help flush those through. Garlic or oil of oregano are hmm, natural. Okay, natural antimicrobials. So, what you can do there is you can actually take that internal, and I always put mine in a carrier oil and some black seed oil, but you can put a few drops in coffee. You can put it in plain water. It's not going to mix real great in the water, but it can be done for those, and that does help with that. I prefer the oil of oregano. It's not as strong as garlic, but garlic is going to do the job. But I promise you, um, if you sweat in the next 3, 4 days, everybody's going to think that you are like fighting off vampires because it's really strong. Another thing is to avoid sugar and things that convert into sugars during that, because with a UTI, well, with anything, bacteria loves sugar, cancer loves sugar. Any of these fast multiplying cells have to have more energy than what a normal cell would have. So they are attracted and drawn to um, your sugar, your glucose. Another thing you can do if your stomach can tolerate it, and if you have it, is having uh, like your sugar alcohol. Now, I have to be very careful. I can do stevia and I can do like xylitol for my tooth powder. And I do have allulose that I have not used yet, but I do have some. But bacteria and these other cells that are fast multiplying, they see that as an energy source. But when they get to it, they cannot use that energy source because it is not a true sugar. So that is something too. But I would avoid sugar if you're having that issue. For interstitial cystitis, um, elimination diet is going to be key on that, which includes a lot of the triggers for this is going to be citrus. And I hate to say this out loud, but caffeine and spicy foods. Alcohol is another one that can cause it, but a lot of people are not doing some of these things anyway. But a lot of people are still doing the caffeine. Just know that if you're having these type of symptoms, that's a good thing to try to stop all of those things and just eliminate those things out and see if that helps you any. Aloe vera is very friendly to helping calm digestive system for one, whether that be esophageal, stomach, small intestine, large intestine, whatever, doesn't matter. Same with the bladder. It's very calming for that. So you could take a few swigs of that. Another thing is marshmallow root is very calming. Slippery elm and mucilage are herbs that are really good for the bladder lining. Now, you have to be extremely careful. Like I say, plants, I don't eat 99.9% of plants. I do utilize them for medicine, but you have to be careful and know what you're allergic to. I cannot even touch slippery elm. I am super, super allergic to almost anything from trees. I can't do the bark, I can't do the leaves, I can't do a lot of that stuff. Now, things like elderberry coming from a bush, I can do that. That does not seem to bother me. I don't know. It's crazy. Um, Something that you can do is you can also do magnesium and quercetin. Okay. Now I do have quercetin inside the little box here. So that is QUERCETIN because it is anti inflammatory. It's also antiviral. So any kind of virus you have, quercetin's a nice one to put in your little arsenal to take. And stress reduction. If anybody can figure out how to do that, please let me know. So, eating styles with this do help. So, people who are eating standard American diet are going to have this a lot more. And the sad thing is my experience of working in nursing homes and hospitals is the food quality that is fed to them. It is all high carb, super hyper processed everything else. Even the meat is just like processed to death and slathered with some kind of gravy or sauce or whatever. And it's just junk and it's constant. It's 3 meals a day. Somebody goes down and offers snacks at least twice a day on top of that. And then we wonder why they're sicker and sicker and sicker and Alzheimer's and all the other stuff that seems to get worse with those things. Um, so I do recommend um, at least trying ketogenic. And I would really do elimination for a while and then build onto that. I seen a lot of people that I worked with on my website that had issues with this, that when they went ketovore or carnivore, did even better at preventing these issues from coming up. So it's something that you don't have to necessarily do forever. I choose to continue to eat that way because I try to put a food group in every so often and see if I can, like, does it affect me? Am I feeling okay? Da da da. And if I don't feel good or it affects me in a negative way, then it's out. And then I usually wait 2 weeks to introduce anything else to make sure I kind of have that clean palate. I feel my best doing carnivore and really lion diet with the occasional egg. Um, I was eating like a fermented pickle every so often, and I will if I like my body says that's what I need to do is eat a fermented pickle, I will do so. Otherwise, I'm not going to probably do that either. So I really think that this is something that it's especially female. Not that males can't get this because I've taken care of males that have, especially if their prostate as they get older, the prostate is like a little donut gasket and their urethra has to go through that. And as they get older, it gets harder, swollen, and it pinches down on there and doesn't allow their bladder to empty. They can tend to get these too. I really think water, keeping hydrated is the number one thing. And I swear if I had a dollar for every single client I've ever had or patient who said, I don't want to drink because if I drink, I have to get up and go to the bathroom or I have to pee more often. And I'm like, yeah, but you got to help your filters out because your filters are trying to filter these sandy bits instead of being a liquefied item to go through there. It's just tearing the heck out of everything and scratching everything as it goes down. So that is my 2 cents on that. I'm gonna go back and see if we have any questions or anything. Let's see. Let's see. Jiffy says, "Hi, Laura. I have been waiting to see this tonight. You can guess why. Thank you for this information." Yeah. Coach Juliet, thank you. Sandy, thank you. I never test positive for E. coli, just positive for infection. In that, so that tells me you probably are colonized. You've probably got it. And a lot of times, girls, we used to get it back in when we were little kids from bubble baths. And a lot of that's because it messes with the pH of that area. But then you get colonized and it'll say, yeah, you got an infection, but they can't ever pinpoint exactly what it is. I would definitely do oregano oil. If you do coffee, if you do hot tea, I would definitely do, 3 to 5 drops anytime you start to feel like you're having those issues. And you can do garlic too. I don't mind garlic once in a while. If I've got strep throat coming, that's exactly what I do. Thank you, Sandy. Coach Eden says, I once had a bladder infection so bad the infection went into my kidneys, but yet I never felt a thing, no pain at all. I didn't feel any pain with mine that did the same thing. That's called pyelonephritis until I bent over to tie my shoes. And I was still pretty young. I mean, I wasn't 18, but I was young. And it felt like I had pulled a muscle in my low back closer to my spine than away. And I was like, "What the heck?" And I was like, "Dang it, I'm getting old." That's the only symptom I had. I had no frequency. I had nothing else. It was crazy. So yeah. So Bill is asking, garlic is antimicrobial. It is. It works very well. Um, I am interstitial strep carrier, so I get strep throat. I don't have strep B, but I do get strep throat. Um, like in 21, I had strep throat 4 times that year, mostly from wearing the mask, rebreathing my own crud for, 12 to 16 hours every single day that I worked, which was most of the time 5 or 6 days a week. Um, and so I have garlic honey that is fermented. And if I feel like, oh yeah, and that little tingle in the neck and the throat, if you've ever had strep, you kind of know, like, oh yeah, I know what's coming. And so the last time I had that, it took everything I had. It was literally, I tried everything else and got up at like 2 or 3 in the morning. And I was like, fine. And I chewed a clove of that garlic that was in the honey. And I took 1 spoonful of that honey, which was so disgustingly sweet because I haven't had anything sweet in so long. But when I woke up at like 7:30, I was like, oh, I can swallow without feeling like I am chewing on razor blades. It was amazing. And no antibiotics. And I think 4 years now. Yay. Which is I'm very, very happy about. Um, Napping works. I like napping. Geez, on day 3 fast, no water today though. Oh yeah, I did 24-hour dry fast mixed into a 3-day fast. Charlie um from Darth Carnivore from his channel, he had talked about it and I was like, I don't know. I don't want to trash my kidneys. But then I was like, just look into it and quit being a baby. And you know what? Dry fasting was easier for me to do starting out. Like I've done it a couple times now. When I start a fast, if I start a fast dry and I don't do a water fast, that first 24 hours is easier, much easier than if I do a water fast that first 24 hours and then go into a dry fast. So much easier just to be like, don't need it. And you're not going to die with 24 hours. So that mag is recommended. Yes, magnesium is recommended for UTI because of the bladder contractions, because it's going to help relax that. Because most people that get bladder infections end up with having really bad, I mean, it'll just hit them and they'll have a spasm. And even people with a catheter, when they have, that tube up there should be blocking the whole area, they can have bladder spasms and actually their spasm is so crazy strong that it'll push urine out around that tube that is up in their bladder and they'll wet themselves. It'll be all over their clothes, even though they have the bag hooked up to them. So those spasms are something pretty crazy. But yes, magnesium does work for that. Magnesium glycinate is the one I would recommend. So yeah. So my Mexican drinking buddy was right about taking garlic. Yes. Yes. It's very good. Sharon, hello. And Bill says he is attempting 10 days fast. I did a 7-day fast and then had 1 cup of bone broth that I made. This has been 2019. And then did another 7-day fast after that. So not quite 14 days because I did have that intermission in there with a little bone broth because I'd had like 7.5 hour surgery. So I thought I needed to put a little something in there. Um, but yeah, that's been the longest one. So yeah, good luck. Hopefully you're able to do that. I think it is a good thing to do. I'm not sure. I think it is more beneficial for women to do some of these fast post menopause. I think peri and prior, I think you really need to be very careful and pay attention to your body with the fasting. I don't think they need to do it quite as much. I think it kind of messes with the cortisol with them a little bit more than it does with those of us who don't have ovaries or they have died. And mine have went several years ago. Um, yeah, almost 7, which is fine. But yeah. So anyway, I do appreciate all of you guys being on here. If you like this, please hit the like button. If there's anybody you want to share this out with, please do so. And if you would like to subscribe to my channel, hopefully, if you hit the notification bell, maybe you'll be notified when I come on here. Um, and then I'm going to go over next week's topic, not the week after. I grabbed everything. So next week's topic is I'm going to go over some of the benefits that are a little bit different between the carnivore diet and the ketogenic diet. They're all ketogenic. It's just that some have a little bit, they're just a little different. And so I'm going to talk about some different health conditions and which one of these two really has been seen to do the best for them in overall of seeing everybody. Um, so that is what I plan on doing next week. So I'm going to go crochet, warm up these hands because it is cold in my room in here. And I've got to get some packages ready to send out tomorrow. A lot of my soaps, yeah, they're going out like crazy. Um, and I had a lady right back who's had trouble with like super bad dry skin. And she was like, this is the first time that it's gotten cold that I can use soap that my skin is not dried. Like she says, I actually feel like I put lotion on every day after I use the soap. So I was like, well, that's good. That's that tallow. It is so good for our skin. So good for the skin. So anyway, I do appreciate you guys for being on here tonight. Hopefully you learned something. If there's anything that you're like, hey, I want you to dig up some research on this and let me know some of the information. If there's something you want me to do on this channel, just put it in the comments, leave me a message on that. My email is, connected on here as well, under description. Put it in the comments. And I am a puzzle person, so I love to dig through and try to figure out what's causing what, how to fix this, what are some of the things, whether some of those things may sometimes be a medication to help, not all the time, and not even probably half the time. But I do like to see if there's things that we can do through the way we're eating, what we're drinking, how we're moving our body, and the plants that I think really were put here to be mostly medicinal. So, anyway, thank you guys. I'm going to go try to quiet down the dog. I don't know what dog is up to, but she's out there making a lot of noise. So, anyway, I do appreciate you guys. And as I always say, meet, heat, eat, and repeat. See ya.